Hi, I'm Nicola Dean, ASPS President. For those of you who don't already know, AHPRA and the Medical Board are firming up their planned implementation of changes for cosmetic surgery regulation. And they have got it terribly wrong. They are proposing a second tier for those wanting to perform cosmetic surgery. We are firmly of the belief that cosmetic surgery should only be performed by surgeons. This is what the public expects, and this will lead to improvements in patient safety. The Medical Board of Australia has one role, and that is to protect patient safety. They seem unwilling to call for a change in the law so that cosmetic surgery can only be performed by surgeons. And in fact, they've openly said that surgery can be done by any doctor. We think this is not what the public expects and should be addressed. Not only are there plans for an endorsement scheme, a second tier in cosmetic, in a second tier training, it's a double standard in training. What's more, the Medical Board are infringing on doctor-patient relationships, trying to bring in all sorts of bureaucratic rules, which are not going to strengthen patient safety. Some of these are not evidence-based. Whilst I absolutely agree that it's very important to check for body image disorders such as body dysmorphic disorder, the evidence for mass screening of patients in every cosmetic consultation is lacking. I know this because I've done the research. It's important that we're not just adding layers of bureaucracy instead of genuine patient safety. We also think that it's deeply troubling that a GP referral, but not a specialist referral, must be present for a cosmetic surgery consultation. A referral from a GP for a patient who has medical comorbidities is incredibly valuable. And the role of GPs is vital in our community. But for fit, well patients who may not have an ongoing relationship with a GP, then this referral system is likely to be lip service and clogging up the valuable time of general practitioners in our community. This will make matters worse in terms of GP timing, and it will not help those patients or all of the other patients served by that GP. Disappointingly, AHPRA has not been listening. Whilst the Australian Society of Plastic Surgeons was invited to the AHPRA inquiry into cosmetic surgery, as well as the Australian Medical Council development of standards, they had us there for lip service. They did not listen. And in fact, they have not listened to any of the specialist surgeons involved in their committees. Why this is a mystery. Perhaps it's their agenda to reduce the monopoly on surgical training. Perhaps it's some other agenda. But whatever their reasons, they should look again and think about their primary role, which is to protect the public. We would ask AHPRA and the Medical Board to reconsider and to look at how their policy of having double standards will really affect patient care. ASPS has been trying to work for the membership to support these points. We've met many occasions with RACs, both through meetings with Sally Langley, but also RACs Council. We've worked alongside other surgical specialties to ensure broad support for our points. And I have met with Minister Butler. We're extremely frustrated that these meetings have not led to the outcomes that we think are needed for patient safety. We continue to act both within organisations, but also to media. I've personally had interviews with Channel 7, Channel 10, The Age, the Sydney Morning Herald, and have put these points across very strongly. What you can be sure of is that ASPS will be continuing to support our members and put the voice of our members and their patients forward. ASPS is now looking into potentially engaging a lobbyist and looking at other avenues for influencing change. I would ask you to bear with us during these difficult times, and believe me when I say that we are trying so hard, but have met significant barriers. Thank you for listening to this message.